Hello, and welcome to another episode of Dr. Carson. Today we have a very special guest all the way from Newton, Iowa. This person wants to come to talk to the doctor in front of a live studio audience as a last resort after trying many psychotherapies. Here she is now. Let's give her a big round of applause.
Hi, I'm Dr. Carson.
Nice to meet you. My name is Lily.
Welcome. What brings you in here today?
Well, doctor, you were kind of the last option for me, actually. I've tried many therapists with many different techniques, from group therapy to just giving me a handful of rocks.
And none of them worked?
Nope, I mean, not permanently. Some of them did work for a little bit before the effects kind of just faded away.
Which ones worked at least temporarily?
It felt like the rocks did help a little bit until someone reminded me that they were just rocks.
That's a great example of the placebo effect.
What's that?
The placebo effect is where your hopes that something will work influence your improvement.
That does sound about right.
Incoming call from one of Lily's previous therapists. She might hold some helpful information about her prior treatments.
Hello, Dr. Brewer. So happy for you to join us.
So happy you invited me. It's an honor to represent therapists from all over the world.
What methods did you use to treat Miss Ray?
Well, I tried the eclectic approach, and it worked for a little bit.
Why wasn't it successful?
Unfortunately, Lily did not follow her plan or show up to her appointments.
So what did you do then?
Then I tried group therapy, thinking maybe a group setting would hold her accountable, but that just made her avoid treatment even more.
Well, you must have a lot of empathy helping your patients like that.
Thank you. I do what I can.
Do you have any advice on treatment methods that could work on Lily? Anything that you wanted to try and didn't get the chance to?
Yeah, I wanted to try psychoanalysis or free association. Have you heard of those before?
Yes, I have. Maybe that would give Lily some insight on why she's behaving the way she is.
I would have loved to try it on her, but I think she would have shown some resistance.
Have you ever thought about trying dream analysis? I think that could work.
I've never thought about it. It might work for you.
I'd be willing to try anything Dr. Carson wants me to. You remind me a lot of my dad.
That's pretty normal. Sounds like you're experiencing transference.
Interesting. I've been really anxious about this working, so I did do some research before coming on the show today.
What did you find?
Well, I read about something called client-centered therapy. From what I read, I thought it might work.
With how well I know you, I would recommend something more like non-directive therapy.
I'm gonna have to go with Dr. Brewer's idea on this one. Sorry, Miss Ray. I think we could practice some active listening if we do non-directive therapy. It would be good for you. And don't worry about being embarrassed, because I can tell you are.
Yes, don't worry, Lily. Dr. Carson uses unconditional positive regard and won't judge a thing you say.
Man, am I really that easy to read? I don't want you guys to think I'm crazy, especially because I'm in front of an audience.
Being embarrassed is totally normal. Don't worry. We haven't really discussed what is wrong with you yet.
What do you mean? I thought you already knew.
I didn't get a chance to check your report, but we know for sure you need behavior modification.
Thank you, Dr. Brewer, so much for helping me previously with all my issues, and thank you for coming on the show so Dr. Carson can get to know me and my problems a little bit better so he can help me to the best of his ability.
Yeah, thank you for being on the show. Sorry you couldn't make it. Really appreciate all the insight you gave me.
Well, thank you so much for letting me talk to you. It's been so good to hear from you again, Lily.
You as
Thank
well.
Well, folks, we're going to take a short break. When we return, we're going to discuss what type of therapy Lily needs and what her treatment options are.
I'm JC, a real live customer of rock therapy. Let me tell you how they changed my life. Before rock therapy, JC was extremely depressed and sad all the time. But the second she got her rocks from her therapist, she was happy and enjoying life again. As you will see in these next few clips, this is JC enjoying her life again, getting out of the house and finally having the confidence to be around other people. Rock therapy truly did change her life for the better, and now she's back to feeling like herself again. Talk to your doctor today about rock therapy and ask them if you're eligible. Side effects of rock therapy may include broken fingers, bruises, and maybe some broken windows.
We hope that rock therapy can help you the same way it's helped thousands of other people across the globe. Call 1-800-ROCK-THERAPY to see if you're eligible for rock therapy today.
Welcome back, and I hope you enjoyed our commercial break. Let's get back to the show.
I took some time over our commercial break to take a look at Lily's report. It looks like she was diagnosed with bipolar disorder and anxiety. We're going to discuss some treatment options.
I really hope you can find something that's going to work for me.
There are 2 different types of therapy we can use to help you with your bipolar disorder. Cognitive therapy will help you to use your thoughts to control your emotions, and behavior therapy will help us control your behavior through conditioning.
I'm really excited to try these out.
I also have 2 types of therapy to help with your anxiety. Rational emotive therapy will help you to not think negatively about yourself, which will eliminate your social anxiety. Systematic desensitization will help you overcome your anxiety as a whole.
Those sounds like they'll work for me. I also read about a thing called adverse conditioning, but it sounded a little intense to me.
Well, that has been proven that it doesn't really work, but contingency management is more effective in helping patients. Sometimes a token economy is set up to reward patients that do well in contingency management.
What is a token economy?
It's when a desired behavior is reinforced with valueless objects.
So, kind of like my rocks?
Kind of. It's more like a gold star for doing something right.
So, what kind of treatments were you thinking for me then?
We can put you on some sort of drug therapy. There are 4 main types of psychoactive medications: antipsychotic, antidepressants, lithium carbonate, and anti-anxiety drugs. Now we just have to find which one will work best for you. If you're not wanting to be on any type of medication, we can do electroconclusive therapy.
Those seem pretty doable, but some of the other treatment options I've heard of seem kind of scary.
I'm assuming you're talking about psychosurgery. It is very scary, but it's also extremely rare. I won't have to perform that on you.
Well, that's comforting. What about a
Prefrontal lobotomy?
Yes, that!
Well, that's a type of psychosurgery. And like I said, we won't be doing that on you. You're not that crazy.
Oh, thank God.
How do you feel about being on a medication? Is that the route you're wanting to take?
Yeah, I think so. Which one did you think was going to be best for me? There were a lot that you listed off.
I'll prescribe you an anti-anxiety drug to help keep your anxiety under control, and I'll put you on some mood stabilizers to help with your bipolar disorder. You can take these for a few months, and then we'll see you back on the show to check you on your progress and see if we need to change anything.
Wow, I'm really glad I came to see you. Thank you so much for helping me.
You're so welcome. I'm glad you can make it on the show today. Hopefully the medicines I prescribed to you will help. We'll see you back in 6 months.
Thank you.
Well, that's all the time we have for today. Thank you all for watching, folks. We will be sure to check in to our patient and make sure she gets all the treatment she needs. See you all next time.